Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. Many of you may have seen the news from the last few days that the CDC director, Dr. Rochelle Walensky, is resigning. She's resigning at the end of June. I don't know why she can't actually resign any sooner than that, but she's going to be in the position for 6 or 7 more weeks. And I'm not a fan of Dr. Walensky by any stretch of the imagination, and that is an understatement. I believe in her time as CDC director, she has helped to completely erode trust in the public health organization. It was already pretty bad, but trust levels have now sunk completely through the floor. And throughout her time in charge, she has consistently shown that she doesn't know how to critically appraise data. She has made exaggerations to suit the narrative. And yes, let's say it, let's call it what it is, downright lies. And that is not how a top doctor or public health official should conduct themselves. So needless to say, as far as I'm concerned, good riddance that she is leaving, and it couldn't come soon enough for me. It is an important job and she has done a lot of damage in her position. So seeing as she is leaving, let's remind ourselves of all of the statements she has made during her time in charge, especially, of course, all of the statements related to the pandemic.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real-world data.
Really? The jab stops the virus? Now, I'm a physician and I think of myself as a person of science. I never understood from the very beginning the logical reasoning behind how a jab would stop the virus from transmitting. I never understood this, and she was one of the people from the very beginning who was consistently saying that this was the case, that the jab would stop transmission. How on earth this was ever the case? How on earth anybody who was a doctor or a scientist thought that this would be possible, I will never understand.
I think I can tell you where I was when the CNN feed came that it was 95% effective, the vaccine. So many of us wanted to be hopeful. So many of us wanted to say, okay, this is our ticket out, right? Now we're done. So I think we had perhaps too little caution and too much optimism for some good things that came our way. I really do. I think all of us wanted this to be done. Nobody said waning when oh, this vaccine's going to work. Oh, well, maybe it'll work, it'll wear off. Nobody said, well, what if the next variant it's not as potent against the next variant.
Oh, really? A top doctor, someone in a top position, gets their information from a CNN headline. What happened to the good old-fashioned way of people in medicine and science actually reading journal articles, spending the 20 minutes it takes to read a journal article, to critically think, to break down data themselves, and not go on a headline from a TV station that is sponsored by a big pharmaceutical company?
This is a really important point, and that is the guidance that we released on Thursday is about individuals and what individuals are at risk of doing if they are not vaccinated. If they're vaccinated, they are safe. If they are not vaccinated, they are not safe. They should still be wearing a mask, or better yet, get vaccinated. We also need to say that this is not permission for widespread removal of masks. For those who are vaccinated, it may take some time for them to feel comfortable removing their masks.
Now, this is also something that has irked me from the very beginning. Where was the data? Where were the randomized control trials? I've seen some evidence recently and it kind of goes the other way. Medicine and science is not there to cater to people's emotions. Show me the data, show me the science on face coverings.
I know many parents are enthusiastic and have been texting me, can't wait to get their children vaccinated. I recognize that some parents want to sort of see how it goes first, but I am encouraging all parents to get their children vaccinated. Some parents won't want to be first, but I'm also encouraging children to ask for the vaccine. I have a 16-year-old myself, and I can tell you he wanted to get the vaccine. He wants his life back. These kids want to go back to school. They want to go back to the things they love.
Really, it's important to target the younger, low-risk age groups? If this was the case, then why weren't other countries, which are also known for being highly educated with good healthcare systems, why were they not pushing as hard as the United States? Explain that to me. What's unique about the United States that they would want to push so hard in this low-risk age group?
I'm going to pause here. I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now, I'm scared. I know what it's like as a physician to stand in that patient room, gowned, gloved, masked, shielded, and to be the last person to touch someone else's loved one because their loved one couldn't be there. I know what it's like when you're the physician, when you're the healthcare provider, and you're worried that you don't have the resources to take care of the patients in front of you. I know that feeling of nausea when you read the crisis standards of care and you wonder whether there are going to be enough ventilators to go around and who's going to make that choice.
Impending doom, that doesn't sound like a very doctor-like thing to say. To me, the physician should be the calm head. They should be stoic. They should be like the captain of the Titanic, even when times are bad. You are not there as a doctor to instill panic in your patients, but impending doom is not a very doctor-like term to use.
So there's actually hope. We don't have data yet. We do know that the higher levels of protection, certainly in the Alpha variant, resulted in less transmission, and we have not yet seen the data, but we are hopeful that the booster will not only protect you, give you a higher level of protection, not just against the Delta variant, but against a broad range of variants, but it might also decrease the level of virus that you have and make it less transmissible if you happen to be a breakthrough.
Is that really the case? Where's the evidence behind that? Boosters affecting transmissibility.
I want to start with myocarditis, that rare heart inflammation. There are now more than 300 cases being investigated. Of course, that's out of millions of people who've been fully vaccinated. Is there enough evidence, though, now to officially confirm the link between the vaccines and this rare condition?
Good morning, Whit. Thanks for having me. We certainly are looking at this carefully. We have an ACIP meeting that has been scheduled for next week, and we are going to be eager to look at the data during that meeting.
So here's a tip. If you're a doctor or any other medical professional, you take side effects and adverse events seriously. Remember, nothing is rare to the person who suffers it. I repeat, nothing is rare to the person who suffers it. This was an issue that was worrying a lot of people. Remember, in other countries, the jab was actually pulled from the market because of this concern. You don't have a meeting next week, you have a meeting now. This is extremely important and shows some empathy and compassion for people who may have suffered with a side effect. No matter what the numbers are, that's your duty as a physician. And let's not forget her unwavering support for mandates.
Are you hoping that private companies, I know it's their decision, but are you hoping that private companies will follow suit?
I am hoping that we will do everything to unify as a country to get more and more people vaccinated. And if that's one strategy in our toolbox, I'd be all for it.
So let's see what happens next with Dr. Rochelle Walensky. My own suspicion is that she is going to take a very lucrative job in big industry, probably a big pharmaceutical company like lots of her predecessors have done. And that is how our system works. The revolving door between government and big corporations. It's absolutely terrible, but let's watch this space to see what happens next. And also remember this, although I'm very glad that she is leaving, that she's going to be gone for now from the public arena, let's remember what may happen next, because we have a clown establishment, we have buffoons in leadership positions across the board, but especially in medicine. And take as an example this statement from Dr. Ashish Jha, the White House pandemic coordinator. Rochelle Walensky has been an extraordinary leader and a terrific partner. She has done the critical work of launching major reforms to ensure we have an even more effective CDC. That is how out of touch our leadership is. So what may happen next? Well, I suspect that there's a fair chance that we may get a CDC director who is even worse, who's even more foolish, who has even less of an understanding of real evidence-based medicine, definitely no understanding of a focus on real health and well-being, and someone who may well even be more corrupted. So we have nothing to celebrate, but at least for now, Dr. Rochelle Walensky is out of the picture. Thanks everyone for listening. Let me know your thoughts down below. Check out my online course and my Uncensored platform. Those links are down below. Remember, huge swathes of healthcare and medicine are completely corrupted, and one of the best things you can do for your health and your family's health is do your best to stay as healthy as possible. Make the right decisions every day so you stay away from mainstream medicine and doctors, or at least you have the best possible chance of staying away from mainstream medicine and doctors. That would be my best advice for you. Thanks everyone again. Hit the like button if you like this video and the bell button for more similar videos in the future. We will talk again very soon.